Hi everyone, welcome back to Global Academy of Medical Education. So in this session, let us see which are all the drugs which can cause teratogenic effects. Myself Dr. Padmanabha, TS Pharmacology faculty at Global Academy of Medical Education. So these are some of the important topics you should remember, and these topics has been repeated many times in your exams. So coming to the drugs and their teratogenic effects. So as you can see here, so the drugs which can cause the teratogenic effects are, the first is the thalidomide. First is the thalidomide. So thalidomide is known to cause a teratogenic effect called as phocomelia. Phocomelia. It is also called as seal-like limb deformity. So in your exams, if they ask which is the drug which is going to cause the phocomelia, your answer should be thalidomide. So what does this warfarin will going to cause? So warfarin will going to cause the Contradi syndrome. Contradi syndrome, as well as it also causes fetal warfarin syndrome. Fetal warfarin syndrome. So what about the phenytoin? So please remember, phenytoin will going to cause fetal hydantoin syndrome, which is characterized by microcephaly, cleft lip or cleft palate, as well as hypoplastic phalanges. So you can call it as a triad of teratogenicity, which is caused by phenytoin is microcephaly, cleft lip or cleft palate, as well as the hypoplastic phalanges. So next, what about the carbamazepine? So please remember, the carbamazepine will going to cause the neural tube defect. And also the methotrexate are known to cause neural tube defect. So what about the isotretinoin? So please remember, isotretinoin can cause various multiple anomalies. Please remember, it causes multiple effects which are mainly related to cardiovascular system, central nervous system. It can affect the ocular system. It can affect the faciocranial system. Faciocranial system. So next, coming to the carbamazepine, carbamazole and the methimazole, which are the antithyroid drugs. So these drugs, please remember, they are known to cause a aplasia cutis. And also especially the carbamazole is known to cause atrasias. So it can cause esophageal atrasia, or it can cause choanal atrasia. Apart from that, it can also cause, both of them can cause hypothyroidism. So this is about some of the drugs. So we'll moving on to the next drug which can cause some of the teratogenic effect. So we have a ACE inhibitor, that is angiotensin converting enzyme inhibitor. So these drugs can cause mainly the renal dysgenesis, abnormality in the renal development, and also it leads to abnormal growth. So abnormal growth, they'll be defective in the growth. So what about the diuretics? So diuretics can also cause renal dysgenesis as well as abnormal growth. Apart from that, it also causes oligohydramnios. Oligohydramnios which can lead to abnormal fetal development. So what about the lithium? So lithium is known to cause the cardiovascular anomaly, that is Ebstein's anomaly. So what about the tetracycline? So please remember, tetracyclines are known to cause a defect in the teeth, as well as it will retard the bone growth. So what about the cotrimoxazole? So cotrimoxazole are known to cause kernicterus. So it is also called as yellowish discoloration or yellow baby syndrome. So what about the fluoroquinolones? So fluoroquinolones are known to cause the teratogenic effects like cartilage damage. They are also known to cause tendinitis, and they are also known to cause arthropathy. So what about the erythromycin? So please remember, erythromycin is known to cause CHOPS. What is CHOPS? It is the congenital hypertrophic obstructive pyloric stenosis. So it is the pyloric stenosis. So what about the diethyl stilbestrol? So diethyl stilbestrol are known to cause clear cell carcinoma of vagina in case of female offsprings, but they are also known to cause testicular carcinomas in male offsprings also. But most commonly it is proven to cause clear cell carcinoma of vagina in the offsprings. So next, coming to the teratogenicity, that is mediated by the misoprostol. So misoprostol is a prostaglandin analog. It is known to cause Mobius syndrome. So what about the streptomycin? So please remember, streptomycin is an aminoglycoside. They are more prone for ototoxicity as well as the ototoxicity and nephrotoxicity. What about the COX inhibitors? So especially the NSAIDs, anti-inflammatory agents, which inhibits the COX enzyme, especially if they are given in a third trimester of the pregnancy. They are known to cause premature closure of ductus arteriosus. What about the quinine? Quinine, which is used as an anti-malarial drug, they are known to cause retinopathy because of their deposition in the retina. They are known to cause retinopathy. They are also known to cause the congenital deafness. So there can be blurring of vision as well as the decrease in the hearing ability. So what about the amphetamine? Amphetamine are known to cause hepatic calcification, and also they are known to cause arteritis. So what about the gray baby syndrome? So gray baby syndrome is usually seen whenever you give a chloramphenicol. So gray baby syndrome is associated with the chloramphenicol. So these are some of the very important teratogenic effects that can be seen with some of the very important drugs. So please remember, in your exams, at least one question will be there from the drugs causing teratogenic effect. Please go through it before going to the exam, and this is one topic which will yield you a high marks in your exams. So please do not forget to revise before going to the exams. Thank you.